Welcome back to Good Morning Vail. Joining us in the studio now, we have Dr. Lipton from the Vail Valley Medical Center. Doctor, how are you doing this morning?
I'm great. How are you?
Doing well.
Right.
It's getting ready for the ski season.
All right, ramping up, isn't it?
We are.
Right.
Well, so we were talking just before we went on about some information that you had for us, some medical tests.
Yeah, well, I spend a lot of my time each day, seeing patients and talking about all the medical tests that are out there that people can choose to have or not to have. And there's a lot of talk about what's the risk, what's the benefit of tests, like mammograms and pap smears and blood tests and all that sort of thing. So I thought today we'd just talk about a few of the more common ones that I talk about every day with people.
Wonderful.
Yeah.
Well, I know with mammograms, breast cancer is definitely something that even the NFL is trying to bring awareness to, which is wonderful to see. Nationwide, we're trying to bring awareness for this disease. But I know that there has been some changing of what they recommend for the testing, correct?
Yes, there's been lots of studies done, and there's a lot of opinions out there about what those studies mean. So there's variable recommendations, so people can be confused about what exactly they should get. So the most conservative or the most aggressive screening for a mammogram, for example, is to start at age 40 and have it every year up until like age 75. So that's the most aggressive screening by certain organizations. And then the U.S. Preventive Task Force, a little bit less aggressive, they recommend starting at age 50 and having one every other year until age 65. So it depends on who you want to listen to and what your own risk tolerance is for women as far as mammography and breast cancer screening. So it's individual.
Okay. Is that something that you would want to kind of weigh your options with hereditary factors?
You talk about family history, other risk factors that are out there, and I sort of help the person make an individual decision as to what's right for them. Okay.
What's another test that you like to see done regularly? Or
So along the same line, pap smears, for example. This is a cervical cancer screening, which has been a huge success. I mean, we've seen cervical cancer used to be a leading killer among women, and now it's a very small percentage of women because of the pap smear. But what a lot of women don't know is that over the past decade, the recommendation has really changed from getting it every single year to really every 3 years for women aged 21 to 65. And if you have what's called an HPV or a viral screen, you can go every 5 years. And then at 65, you can stop. Certainly, if you have an abnormal pap smear, you have something else, you're kind of taken off of that schedule, and you should follow the advice of your gynecologist there.
Now, I know that there's vaccines for the HPV and everything else. With some of the younger generation that are now having this vaccine, is it the same recommendation for testing?
It is the same. I think that's why we're seeing sort of a spreading out of the frequency. So this is something that's evolving. You kind of have to keep up with the recommendations as they change.
Great. If people wanted to learn more information about mammograms or pap smears, how could they do that?
Yeah, they could make an appointment with us, see the website, vvmc.com/Lipton. Call the office. The number should be on the screen, I think.
It is, yeah.
And we had some other tests. I don't know if we have time to go into anything else.
I don't think so.
Okay. But we'll talk about it next time.
Sounds good.
Right.
Doctor, thank you very much for joining us. Great information. Always a pleasure to have you on.
Okay, thank you.
Stay tuned. We got more coming up.